Hello and welcome to another video of this course. This is module 5 and we're learning about menstrual health and menstrual hygiene, and under that we're going to look at the menstrual cycle, menstrual hygiene challenges, myths and facts about menstruation, and menstrual pain symptoms, causes and management. So let's get right into it. What is menstruation? Menstruation, also known as a period, is the monthly shedding of the uterine lining through the vagina. It is a natural biological process that occurs in females, usually beginning between ages 19 to 15 and continuing until menopause. Menstruation is the natural cyclical shedding of the uterine lining called the endometrium that occurs monthly in women of reproductive age. Now, what is menstrual health? Menstrual hygiene refers to the practices and processes involved in maintaining cleanliness and comfort during menstruation. And this includes using appropriate absorbent materials, changing them regularly, maintaining cleanliness of the body, and having access to facilities for disposal. Menstrual health and hygiene involves ensuring women and girls have access to safe and affordable sanitary products, clean facilities, and the knowledge and resources to manage their periods with dignity and without health risks. Now, there are various aspects of menstrual health, and they include access to safe and affordable menstrual products, clean and private facilities, knowledge and education, proper disposal of used menstrual products, hand hygiene, proper body hygiene, regular checkups, addressing stigma and cultural norms. So let's look at menstrual hygiene practices. Good menstrual hygiene involves keeping the genital area clean and practicing healthy habits during menstruation to prevent infections and maintain comfort. This includes washing hands before and after using menstrual products, changing products regularly, and using appropriate absorbency levels. So some of these practices enumerated are: wash your hands before and after the use of the restroom and before and after using a menstrual product. Discard used disposable menstrual products properly by wrapping them with a toilet paper or tissue or other material and then toss in a trash bin. Do not flush menstrual products down the toilet. Change sanitary pads every few hours, no matter how light the flow. Change them more frequently if your period is heavy. Change tampons every 4 to 8 hours. Do not wear a single tampon for more than 8 hours at a time. Use the lowest absorbency tampon needed. If you can wear one tampon for up to 8 hours without changing, the absorbency may be too high. Clean cups every day after use. Sanitize menstrual cups after your period by rinsing them thoroughly and placing them in boiling water for 1 or 2 minutes. And next is follow products. When you're using menstrual underwear, always wash them so that they are clean. So next we'll be moving to menstrual hygiene challenges, also known as MHM. And MHM presents significant challenges for many, particularly in resource-limited settings, affecting health, education, and well-being. These challenges include the lack of access to essential materials and facilities, insufficient knowledge and understanding of menstrual hygiene management, and cultural and social norms that can stigmatize menstruation. Some of these challenges are: one, lack of access to materials and facilities. Many individuals, especially in rural areas and low-income communities, lack access to affordable sanitary products, clean water, and adequate sanitation facilities. This can lead to the use of non-absorbent and unsanitary materials, increasing the risk of infections and other health problems. We also have lack of information and education. Many individuals, especially young girls, lack accurate information about menstruation and menstrual health management. This can lead to harmful practices, misconceptions, and negative attitudes towards menstruation, further exacerbating hygiene challenges. We have cultural and social norms. Cultural taboos and discriminatory social norms can stigmatize menstruation, leading to social exclusion, shame, and even violence. We have water, sanitation, and hygiene infrastructure. Inadequate water, sanitation, and hygiene infrastructure in schools and communities can make it difficult for individuals to manage menstruation hygienically. This can lead to discomfort, leakage, and increased risk of infections. We also have economic factors. Poverty and economic hardship can limit menstrual health management materials and facilities. Now, we'll be looking at emotional and social aspects of menstruation. Menstruation, while a natural biological process, has significant emotional and social implications for individuals and society. Emotionally, women may experience mood swings, irritability, and other physical and mental symptoms before and during their period, which can affect their daily lives and relationships. Socially, menstruation is often shrouded in stigma and taboo, leading to secrecy, shame, and discrimination, particularly in some cultures and communities. Let's look at emotional experiences during menstruation. Menstrual cycles often involve hormonal changes that affect the mood and emotions. These emotional shifts are normal and natural, but without proper support and understanding, they can lead to distress. So we have mood changes and PMS. Many women experience premenstrual syndrome, which is known as PMS, a group of physical and emotional symptoms that can include mood swings, irritability, fatigue, and depression. They also experience stress and anxiety, depression, and sometimes depression and suicidal thoughts. Social experiences during menstruation may include stigma and taboo, as we already said, discrimination and exclusion, because in some cultures, menstruating women might be restricted in certain activities or social settings, which can lead to discrimination and exclusion. We have limited access to information and resources, impact on education and work, because sometimes girls have to miss schools, women have to miss work just because these facilities don't put in place proper infrastructure for women during this period. Then we also have impact on social support and relationships. Next, we'll be looking at myths and facts about menstruation. Like we already said, it's a natural bodily process, but is often shrouded in myths and information. And one of the common myths is that menstruation is dirty and unclean. And it is untrue because menstrual blood is like any normal bodily fluid. Another myth is that it's shameful, and that is why people don't usually have open discussions about it. Factually, menstruation is a natural and essential part of a woman's reproductive cycle, and there is no way or there is no reason to feel ashamed or embarrassed about it. Understanding the facts about menstruation can help dispel harmful myths and promote healthy discussions about women's reproductive health. Now, let's look at some of these myths. Menstrual blood is dirty and unclean, periods are shameful, you can't swim or exercise during your period. As a matter of fact, you can swim and exercise during your period. Tampons are unsafe for virgins. Tampons can be used by anyone and does not affect fertility in any ways. Also, some people have said that the menstrual cycle is always 28 days. On average, it is 28 days, but it could be more and it could be less. So now let's learn about the facts. Number one is that menstruation is a natural process. Number two, there is no need to be ashamed. Number three, you can be very much active during your period. Tampons are safe for everyone, and menstrual cycles can vary. Now let's just touch a bit on menstrual pain, also known as dysmenorrhea. It's pain felt during menstruation, typically in the lower abdomen. It can range from mild to severe and may be accompanied by other symptoms like nausea, headaches, and fatigue. The pain usually starts around the time menstruation begins and lasts for a few days. Now, there are two types of menstrual cramps, which are primary dysmenorrhea, which is the common menstrual cramps without an underlying disease. And this is usually experienced in adolescents. Right. The second type is the secondary dysmenorrhea, which is caused by reproductive disorders such as endometriosis or fibroids. Now, what are some of the causes of menstrual pain? Number one is that the uterus contracts to help expel its lining, and these contractions are triggered by hormones called prostaglandins. Higher levels of prostaglandins can cause stronger contractions and more pain. In secondary dysmenorrhea, underlying health problems such as endometriosis, pelvic inflammatory disease, or fibroids can worsen the pain. Some common symptoms of menstrual pain include cramping in the lower abdomen or pelvis, pain that may radiate to the lower back or thighs, nausea and vomiting, headaches, fatigue or tiredness, dizziness, bloating, or loose stools. But these are some tips for managing dysmenorrhea: pain relievers, heat, exercise, stress management, dietary supplements, birth control pills, and other treatments that may include hormonal therapy, surgery if needed. So thank you very much for watching this video. We'll be moving over to our next module. Bye for now.